Welcome, friends, to a very special edition of our live program. Those joining us are probably aware we've got Barbara O'Neill live Q&A. And so your questions are going to be answered in this program. Load them up in the chat. And I know this is a highly anticipated event. I am your honored host, Scott Ritsema, and it's a joy to be with all of you today. I know that God has given a gift to this world in his servant, Barbara O'Neill. And I know she would emphasize that word servant. And we just appreciate so much what is the gift to humanity and to God's church and to every hurting person in need of healing, and to help us all just live our best life in service to God and for our fellow man. So it's an honor to begin this live program, and also not to neglect our sponsor that makes all of these programs possible, our LSR store. And right there, I did it again, guys. I got to fight something off using all the methods of the 8 laws of health. It's cold and flu season, right? So you get hit with something. You feel it maybe first in the throat or in the nasal passages. And it comes on. This time it came on hard. It came on fast. I started spraying the Revitagard throat spray, in addition to no sugar, plenty of rest, water, hydrotherapy, and then the nasal spray, the Revita Sinus. And praise God, that same day, by the end of the day, I was feeling great. So, use as a foundation for your immune system all the basics that you learn from Barbara O'Neill, that you know from just nature and living God's way. And then little bonus like that, use that QR code for those Revita Living Products immune boosters, my personal favorite. I keep those with me when I travel. My family uses them, although I use them more consistently than my family, and I'm the one that doesn't get sick. So praise God. Now that I've said that, I'm going to, aren't I? Let's bring Barbara up. Should I have not said that, Barbara? I'm going to get myself in trouble now. But I want to bring up our honored guest, Barbara O'Neill. And before we go to the questions, Barbara, I understand that we've got 2 excellent books. Barbara O'Neill as the author of both of them. They're both great resources. What is the difference between the 2? Is it important for folks to have both, or is just one? What are the 2 books, and tell us about them, if you would, please.
Well, hello and welcome everyone. It's great to be here. So my 2 books. One book I wrote, I can't remember now, maybe about 10 years ago. It's called Self-Heal by Design, and it's a book that explains the true roles of microorganisms in disease. It shows that germs don't cause disease. They're the result of unhealthful conditions. I also have a look at the link between fungus, yeast, and disease today. I use a lot of resources, so it's not just off the top of my head. I also show programs where you can conquer yeast in the body. I also show the link between cancer and fungus. And at Misty Mountain in Australia and also Living Springs in Alabama, we've had some quite incredible turnarounds from even serious diseases like cancer with these simple principles. And then it was probably about 3 years ago, I started to put together Sustain Me. I had a lot of people say to me, Barbara, what can I do for this? What can I do for that? And I realized that I needed to put out a book that addressed a lot of the basic problems that people have today, from arthritis to heart disease to osteoporosis, hormonal imbalances, respiratory. You just talked about respiratory, so a whole lot of areas. And I start at the head and I go down. I've got a chapter on the eyes, a chapter on the ears, a chapter on the chest. So I go through the human body systematically. It's interesting, I heard my husband say to someone one day, Barbara's got a very systematic brain. It has to be in order and make sense. So basically it's a handbook on natural remedies, and that's what I wanted it to be. So if someone has a problem, they grab the book, they open it, there's an index at the back. What can I do for my sore throat? What can I do for my sore finger? What can I do for this and that? So that's what my aim was for in the book Sustain Me, to have a handbook on natural remedies.
That's excellent. To me, that's a very good resource for everybody to have on hand. Not everybody likes to read a book cover to cover, page by page. I like to do that. Some people like to do that. But just to have this book on your shelf where you can turn right to that page where it has the answer to the problem you're facing. So I'm very, very happy to offer those at the Living Springs Retreat store, both of those books. And also, when you talk about the organism of the human body, and I want to get to your question. We're going to get to your questions, audience. I just want to say this. One thing I appreciate so much about what you teach, Barbara, is you don't specialize in just one area of the body and look at that as an isolated entity, independent of the totality of human physiology and how we are designed in nature by God to thrive. And so the idea of self-heal and cooperating with nature's laws is just a tremendous benefit to all those who've had the privilege of hearing your messages. So I just want to thank you for that personally and in your book as well. Thank you so much. So Jeremy, I think we're ready. I'm talking to the producer in the back. We're ready to roll right into our questions. Are you ready, Barbara?
I am.
All right. For our big Q&A session, Lori gets to go first. Please, if you could help me, I have brown spots all over my face. I've had it told to me that it's melasma or sun pigmentation, but I don't know that I think it's any of that. It's too much. I hardly have any spot on my face. I mean, I think any spot without the spots. So, Barbara, do you know what that is and what Lori could do?
Well, it sounds very much to me like there's a hormone aspect here, because the fact is we've been living under the sun for a long, long time. But what we're finding that this condition is not uncommon when there's a hormonal imbalance. I know as a lady that had 7 babies, whenever I was pregnant, I'd have some brown marks appear on my face. After I'd given birth, they'd ease away. And you'll notice with medicine, they give you a name, but they don't tell you the cause, they don't tell you the cure. Sometimes they blame the sun, but the fact is, the sun may be a factor, and it is true you can overuse the sun, but many people today underuse the sun. You know when you've overdone the sun? Because the skin burns. So it is true that overuse to the sun in times past could possibly be a factor, but it sounds to me like it could be a hormonal imbalance. And in America, in fact, every country I go to, I get people to look for local wild yam creams. In Psalm 114, the Bible says that God gave herbs for the service of man. And you talked earlier, Scott, about some herbs that you spray your nose and throat when you get a cold. I just thank God for those herbs. And so the cream that can balance the hormones is a wild yam cream. And I know that Living Springs have a few wild yam creams, and I know that Living Springs will not sell anything if it has chemicals in it, so please explore their store. Now, once you apply this yam cream, you apply it to different parts of the body every time you apply it. It's not necessarily to the skin. What's happening in the face is an indication of deeper in the body of this hormonal imbalance. It could take several months, but most people with a hormonal imbalance, and I have to tell you that probably over 80% of people today do have a hormonal imbalance, and that's a whole nother subject. There's a whole lot of reasons for that. But the balancing, you know, it may take a few months. I suggest most people that go on the cream to keep it up for at least a year.
Excellent. 80% of people. So that sounds like something we may all just want to try, see if things resolve that we didn't even realize necessarily we had.
That's right. And what the cream does is it boosts the production of progesterone, and progesterone's mother hormone. She keeps the balance of everything else, and her nickname is happy hormone. So even if you don't know if you have a problem or not, it's not going to hurt to do it, because I'd like to suggest we can't have too much happiness today.
Oh, I love that. I love that. God just wants us to be happy. I think that's beautiful. Dina says, just diagnosed. Oh, sister Dina, we're sorry to hear the diagnosis of endometrial cancer. Barbara, what does she do at this stage?
Endometrial cancer, the endometrium is the lining of the uterus, and any problem to the point of cancer in the reproductive organs, again, is an indication of a hormonal imbalance. Now, the hormone that gets displaced unfortunately, is progesterone, and that's mother. She keeps everything under control. And the hormone that can get out of balance is estrogen. The Australian Health Department have stated that estrogen is a known human carcinogen. So square one is getting the cream that I previously mentioned. And I wouldn't be surprised, Scott, if you'll find a lot of the questions that we have today may be hormone related. So you'll probably hear me say this a few times, but that cream, because it boosts the body's production of progesterone, it brings the endometrium back into alignment by getting estrogen down. So that's very important. You can also apply castor oil compresses to the area. Castor oil penetrates very, very deep and can break up lumps, bumps, congestion, adhesion, even tumours. So that's an important part of this. Another important part is giving the body the right conditions for healing from cancer, and that's where Self-Heal by Design comes in. My book, Self-Heal by Design, has some basic dietary and herbal guidelines to give the body the conditions for conquering cancer. So if I was this lady, that's what I would do.
So there are several steps you want to be taking, and some of those hormonal ones being the basics there. And by the way, Barbara, when you mentioned the castor oil, I've had several friends who've come to know what faith that my family is of, and they go, "Oh, do you know Barbara O'Neill?" And like, "Oh yes." And one of them said, "We applied the castor oil in a context of trying to eliminate breast cancer tumors that had been diagnosed and treated in other ways, and they used this as well to try to really do a natural approach." And, of course, we're not diagnosing, treating, or curing anything in this broadcast, but they found that to be very helpful in their personal journey as well, the compresses that you teach about. So that's excellent. Jeremy, I think we can go to another question. And by the way, Barbara, you don't have to apologize if many of the answers are the similar answers. That just shows how simple this all is. And so keep repeating as needed, whatever the answer is. So how do you naturally cure abscess?
Okay, so the abscess. Now, my favourite book was my first book on health, was called The Ministry of Healing by Ellen White. And in the chapter, The Physician, the Educator, she says, in case of sickness, the cause should be ascertained. In my last few questions, the cause basically was a hormonal imbalance, and then you could investigate as to why that would be so. But with an abscess, my first question is, where is it? And I wonder what would have contributed to this. But we need to deal with the abscess right now. And if it is in the mouth, sometimes the abscess can be caused by a root canal filling, which unfortunately is quite a dangerous medical practice because it's a dead tooth and an abscess often builds up behind that. So that could be treated a little differently than if the abscess was on the body. Sometimes an abscess can develop because of diabetes, especially on the lower limbs. So it's a little bit hard to answer clearly when not knowing exactly where on the body it is. But if it's an open wound, it can be cleaned out nicely with hydrogen peroxide. Even salt water can clean it out. If it's in the mouth, you can rinse with salt water. On the body, rinse it with salt water. Put it in the sun. The sun is a wonderful healer. Let the sun go into that abscess. And a herb that you can sprinkle into the abscess is golden seal. Golden seal is a root, and its nickname is king of tonics to all mucous membranes, but it is also strong antimicrobial. It's even anti-staphylococcic, so sprinkling that into the abscess can certainly help with the healing.
Excellent. Well, I hope you were taking notes, Isaiah 1:18. You got a few tips there. By the way, does that come now? Let us reason together. Love that. Love that scripture. That's what we're doing here together. We're following cause to effect, nature's remedies. Would you recommend a book that outlines, well, yeah, Barbara's book, I mean, she mentioned that in answer to the question about the cancer diagnosis, that in addition to dealing with that hormonal issue and using the compress and the uterine area, you're going to want to go deeper into the bigger lifestyle changes that are needed for cancer prevention and reversing. So for simple natural remedies, that would be which book, Barbara?
For Sustain Me.
Yeah. Excellent. And Jeremy, if you could put that QR code up there one more time, please. That was a big help, I think, to many people when that was published, and many more are finding it. So I recommend all the viewers get that book. So let's go to another question. Any treatment for glioblastoma on the brain? By the way, my dad is an optometrist, and he's on my case that I got to get my glasses. So if I struggle, if I call Michelle Brown Michael on accident or something, you guys will have to forgive me. I'm gonna get that taken care of. I'm in my 40s now, Barbara. I'm joining the club. But what can you answer about that one?
Well, I do appreciate too when people give me symptoms rather than medical names. Sometimes these medical names can be a little bit perplexing, but obviously it appears to be a tumour on the brain, and castor oil on the area can penetrate even through the skull. Castor oil can penetrate through the skull and even help to break up tumours, so I would apply castor oil to the area. And I think we all realise this isn't going to go away overnight. Sometimes we're seeing tumours appear on the brain when someone, that part of the brain has had a mobile phone to it a lot. So electromagnetic fields today, it's called the silent killer because you can't see it, is contributing to these things. And sometimes we don't always know the cause, but often when you look at the history of the person, you can start to see some possible contributing factors. And the reason why knowing the cause is important, because if you don't eliminate the cause, you don't get a cure. Also, there's a herb called red clover. Red clover is a very safe herb. It can be taken in a capsule or a tablet form, and it has a nickname called the herbal scalpel because of its ability to cut away tumours. So I would, if I was this person, take the red clover tablets or capsules several times a day. And again, implementing those basic lifestyle principles you talked about earlier, Scott, which is what my Sustain Me book is based on, which is the basic laws of health: drinking adequate water, exercising, nourishing food, etc., etc.
Excellent. Yeah, you've got to get that basic foundation, folks, through the teaching that she presents in there. Thank you, Michelle, for your question. That's incredible that castor oil penetrates the skull. I did not know that. It goes through the cranium to the brain. That's just God right there. I mean, he's amazing. We have an amazing God. Jeremy, what's the next question? McKean Ramos says, I have a question, but I will be in physical therapy when this airs. So McKean, hopefully you're catching the archive. And folks, you save this link. It's the same link after the program as during. So you just share the archive with everybody you know. So here's her question. I ripped a tendon in my knee and physical therapy is helping. Should I let them operate? So you're talking about surgery, I guess. And is there anything else that McKean should do?
Well, I like to do everything possible rather than operate. And Dr. Kellogg, very famous doctor who had a huge retreat in the mid-late 1800s, I was reading the biography of a doctor who worked with him, and she said he was an excellent surgeon, but he rarely used surgery. So remember that as much as possible, and you can avoid surgery, but at times it may be necessary. Physiotherapists, they're the experts on muscle, ligament, bone, tendon. So very important to adhere to what the physiotherapist says. The other is you can wrap a castor oil compress on the area every night as you sleep. There is a herb that has a growth stimulant, and this growth stimulant is applicable for every cell in the body, so bone, ligament, tendon, muscle, and that's comfrey. And I think Living Springs do sell a comfrey cream, so I would also apply that a couple of times to the day. The other thing is listen. You never do anything that's going to cause pain. There's the pain that's, oh, don't do that. Then there's the pain that, oh, That feels nice. You know, when someone massages your shoulders, oh, yes, keep going, keep going. So only us know that pain. So don't do anything that's going to aggravate it. And there's a 4-letter word, and it's a very nice 4-letter word. It's called time. You got to give it time. It'll take time. And after breaking my wrist in December, I realised that bones heal quickly, but ligaments, tendons, muscle, they can take several months. So give it a bit of time.
Yeah. And you want to be having good nutrition, right, for the healing of those muscles too.
Yeah, that's absolutely the Sustain Me principle. Sustain Me is sunshine, use of water, sleep, trust in God, abstain from anything harmful, inhale through your nose, nutrition, moderation in the good things, and exercise. So they're your laws of health.
I want you to repeat that one again at some strategic point, because that was a really good summation. And you're welcome, McKean. We're very glad to have you. And Jeremy, we can take our next question. So how do you start a baby onto solids when the molar teeth come in? How do you schedule it with the milk feeds? And maybe there's a question behind the question. Is the assumption correct that molar teeth is the indication of starting the solids? And then you could also answer the question how to schedule, filling the tummy with food in conjunction with carrying on with the nursing.
Well, I'm an expert in this, having been breastfed or pregnant nonstop for 14 years. Fed 3 months into every pregnancy. So I'd like to suggest, without any touch of pride, that I am an expert in this area. And that they all survived, and they're doing the same thing to their children. In other words, it worked, and it worked well. In my book, Sustain Me, I have a section called What Shall I Feed My Baby? Now, the first teeth that appear are the 4 at the top and the 4 at the bottom. They're called milk teeth, so baby's main food should always be milk. God made the breast milk perfect. And if the mother cannot breastfeed, the next closest would be the goat's milk. You look at the size of a baby human and the size of a baby goat, very similar. No, the baby cow's much, much bigger, so it has different nutrients. So that's square one. 3 things have to be present for a baby to have any food, and that is they must be able to sit, they must be able to feed themselves, and also they must have a few teeth. And when those 8 teeth are there, maybe they're halfway through, a little bit through, fully through, that's taste time. So you give the baby at the mealtime a piece of cucumber, you give them a piece of apple, or you give them a piece of avocado, it might be a bit messy, or you give them a piece of banana, but let them feed themselves. But when the molars come through, they come through back here. It's usually between 14 and 22 months of age. When the molars are through, that is the sign that they can start having some starch or carbohydrate foods. So the pastas, the breads, the cookies, the cereals, all of that should be kept back until those molars are through, because we grind with molars, and when the molars are through, then ptyalin, which is the salivary amylase that breaks down starch, that's when it's released in decent amounts to be able to break that starch down. But that is defined in detail in my book.
Excellent. Thank you for the glimpse into that. I hope that was helpful. Real quick, Barbara, scheduling it in with the milk feeds once they are eating meals, how do you space that?
Well, the milk should be number one. So while they're just having little taste times, always milk before you give them the little taste, because you don't want them to overdo the taste. You've got to get that tummy ready. And what I found, that when my little ones were about 18 months, 20, 22 months, and they're starting to eat with the family, I would usually give them maybe three feeds a day. I'd feed them to go to sleep, feed them at night to settle them. So you sort of ease it in, but at first the milk should be before the snack, the little.
Great. Okay, we've got a sprained rib. What do we do about that?
Sorry for laughing, but I can laugh because I have had 2 broken ribs. Medicine can do nothing. That's why I didn't go to emergency. I thought, what are they going to do? I did try very hard not to cough or sneeze. Then when you know you've got it. You really
Yeah, just don't make me laugh. Don't make me laugh this week.
you really just have to give it time. And I would apply the comfrey cream a couple of times a day. It's got a growth stimulant. Praise God for Psalm 104 verse 14, where he gave herbs for the service of man. But again, don't do anything that's going to make it hurt. And we really don't want to anyway, do we?
No, that's easy orders to follow. All right, Jeremy, what's next? Cindy asks, I've been off of a very low dose of Prozac for 10 months now. It was 20 milligrams per week. And she's feeling very good, except periods of insomnia. Is there something that she can take for this resistive insomnia?
Well, in my book, Sustain Me, I'll probably be saying that a few times, I've got a chapter on sleep. And I go right into detail on what happens in the night and why we need sleep. I also look at ways to overcome insomnia. Insomnia can be caused by, some previous drug medication. It can be caused by a hormonal imbalance. And the good news is that we can rewire our brain right up until the day we die. You can train yourself back into sleep. And there are some herbs that will help in the process. Some people have found valerian really helps. It's a mild tranquilizer, mild sedative. Some people have found taking magnesium of an evening can help. Some people have found melatonin helps. The research, and Dr. Matthew Walker, who wrote the book Why We Sleep, he shows that sleeping tablets really do not give a quality of sleep. So it's being patient, realizing that you can ease yourself back into sleep. And even if you get a little bit more every night, be thankful. In 1 Thessalonians 5:18, the Bible says, in everything give thanks. So even if you just get 5 hours, be very thankful for that. And hopefully the next night it'll be 5.25 hours, and then 5.5, and you can ease yourself back into that.
That's great. Thank you, Cindy, for your question. By the way, I'm a converted night owl into early to bed, early to rise. You can make the switch. It is humanly possible. It's not genetic. Your destiny is not sealed. So you can become a productive member of society, unlike I once was. Jeremy, who's next? Marjik says, from what point do you give a child water in addition to breastfeeding? And do you also give small children Celtic salt before they drink a glass of water? I think this is a reference to your teaching that we adults, have salt with our water. What is your recommendation for the babies on that front?
Much depends on where you live. I never gave my babies water. I never actually thought about it. Breast milk's nice and watery. But I spoke to a mother only a couple of days ago with a 4-month-old baby who hadn't opened their bowels for 4 months. And I said it might be an idea to give the baby little sips of water. Living in a very hot environment, you might look at giving the baby little sips of water. Definitely by the time they're breastfeeding a little less and starting to eat a little bit more, the water's important. When my little grandchildren stay with me, when they drink 1/4 cup of water in the morning, they can have a piece of Celtic salt. That's their reward. And then they can drink the rest of their water. So even from the age of, probably about 2 years, that little bit of Celtic salt before the water's great. You'll find that when they've had the salt, they'll want to drink more water.
That's good. That's good. Excellent. Thank you for the question. How to cure NA fibroids? Fibroids. Okay. How to cure fibroids naturally, Honey Badger asks.
The fibroids are a result of excess estrogen in the body, because estrogen is it's a cell proliferator, and it's causing so many problems today. And one of the problems that it's causing is the growth in the reproductive organs. This is the main cause of polycystic ovarian syndrome, fibroids in the uterus, cysts, lumps in the breast. So this, different people react in different ways. Not everyone with estrogen dominance develops fibroids, but it is the cause of the fibroids. So going on to the yam cream, that should be applied for at least a year, applying the castor oil compresses, ideally at least 5 hours, 5 days a week, more if you can. The key is consistency here, but we've seen many women conquer their fibroids by doing these two very simple things: applying the yam cream to get the estrogen down, which is feeding the fibroids, and also applying the castor oil compresses, which will penetrate deep and little by little break them up. At the same time, implementing the Sustain Me principles or the basic laws of health. We've seen many conquer fibroids doing this.
Excellent, excellent. So all of these remedies in conjunction with the whole picture of your whole acronym. Give it to us one more time. Sustain Me. What does it stand for?
Okay. The first S is sunshine. We need sunshine. The U is use of water. There's a time to drink water. There's a time not to. When wouldn't you drink water? When you've just eaten your meal. Ideally, you start drinking about an hour and a half after the meal to allow those digestive juices to do their work. The third one is sleep. I like God's perfect mathematical formula: 8 hours to work, 8 hours to play, 8 hours to sleep. T is trusting God. Trust that God gave you an incredible body with an inbuilt ability to heal. Thank Him every day for that body. I is inhale. We need to inhale in and out through our noses. We'll get more oxygen at the cellular level and try to breathe in the freshest of air. Abstain. It is time to stop anything that will harm the body. Anything that is interfering with the healing of the body needs to stop if we want proper healing. N is nutrition. The three essential food groups are fibre. All plant foods had fibre. Protein. Best plant proteins are your legumes, nuts and seeds. Fats. Fat's not the enemy. We need to be having good fats like coconut oil, olive oil, all your nuts and seeds. M is moderation. Yes, the sun's good, but do it in moderation. Fat's great, but don't overdo it. Do it in moderation. And the last one is exercise. We need to move the body every day.
Beautiful, beautiful. Maurice asks, how should I treat silent acid reflux?
Okay, silent acid reflux is unfortunately a problem today. And it's usually a result of eating breakfast like a pauper, lunch like a pauper, and supper is the king and the queen together. So we need to switch when we're eating our main meals, which should be breakfast and lunch. And if we eat at night, it should be very, very light. The stomach requires, digestion takes about 3.5 to 4 hours. So we should be leaving 5 to 6 hours between meals. We should be drinking not with our meals, but between our meals. So all of these basic principles will help to recover from silent reflux. Now, this little valve that sits about here in the top of my diaphragm is called the cardiac sphincter, and that stops any food or acid coming up into the esophagus. So if it's coming up, it can indicate that that muscle is not strong enough. So please do some abdominal strengthening exercises. So you strengthen your abdominal muscles, you'll strengthen that muscle. And also, when it's relaxed, it's closed, that muscle. So when someone's stressed, anxious, that muscle can open, causing the contents of the stomach to come up. So you can take something to help relax that muscle, and that is magnesium. So taking magnesium before you go to bed can help relax the muscle and keep it closed.
Great. Thank you, Barbara. Our next question is from Country Girl. What causes saggy skin, and can it be changed?
Well, unfortunately, our skin will never be at the age of 70 what it was at the age of 10. The skin does start to get a few more wrinkles. If I put my glasses on when I look in the mirror, I see a few more. Maybe that's why our eyes aren't as strong in the latter in the latter years.
That's
But
God's mercy.
God's mercy. But it is true that it's greatly affected by the way we eat and the way we drink. So our massage therapists, they tell me I can tell how much a person's drinking by the way their skin moves when they're massaging that body. So a lot of skin gets saggy and wrinkly because people aren't hydrated. And did you know that 1 cup of coffee requires 5 glasses of water to accommodate for the dehydrating agents in the coffee, especially if there's sugar there too? I was at a function 2 weeks ago, and whenever I mentioned coffee, there was a groan through the whole audience. Oh no, about coffee again. Coffee ages people, especially women, because it just dries out that skin. So if you're a coffee drinker, please don't stop, or you won't be able to function in the next 24 hours. Start easing off it little by little by little. So yes, that very popular drink in most countries today, coffee's contributing to the saggy skin. Also nutrition. We need to be having great fibre, we need to be having great proteins, and we need to be eating some good fats. People say to me, Barbara, what moisturiser do you use? I say, nothing. I don't put anything on my skin. But what I do make sure I do, that I'm eating, I eat about a teaspoon of olive oil with every meal. Our skin is an indication of our nutritional status of our body as well. And unfortunately, this fat-free myth, that has been pushed onto unsuspecting humans for the last 40, 50 years, is also a contributing factor to drying out skin. The fact is it's an essential nutrient and we need it, not to put it on our skin, but to eat it.
Excellent.
It is true also that some people have been born with drier skin than others, and they may need a little something on their skin. If they do, it should be something simple like coconut oil.
Wonderful. Thank you for that. And by the way, doesn't caffeine also increase stress, which also ages us and reduces lifespan and increases disease risk and makes our faces look less happy?
Absolutely. And there's one more thing before we go on to our next question, that is exercise. What exercise does, it increases the circulation of the blood to the skin. And when you increase the circulation of the blood to the skin, it keeps the skin in much better order than if, so it's coffee drinking, dehydration, malnutrition, and lack of exercise. That's what's contributing to saggy skin.
Excellent. Excellent. And that nutrition, I just love your teaching on nutrition. And even with that oil, teaspoon, you're not making French fries in olive oil deep fried, right? I mean, it's like, so everything is in its proper balance. It's beautiful. Hyacinth says, please suggest items for detoxing the colon.
Okay, now Living Spring sells an excellent herbal mix that we use at our retreat in Australia. It's called colon tea. And colon tea contains 3 herbs, cascara, licorice, and buckthorn. And those herbs, when they're taken in the form of the tea, they gently stimulate peristalsis. So many people who've had sluggish colons have found that the colon starts to work better when they take that tea. We also give it to our guests on their juicing days. So on their juicing days, they take the colon tea at night to make sure that that colon is evacuating. There is also a treatment that you'll find in many places called colonic irrigations. And colonic irrigation treatments are when warm water is going in and out of the colon, usually for about 45 minutes, and that can certainly contribute to cleansing the colon. So there's a few things you can do. The Sustain Me principles, exercise, hydration, fibre, they all contribute to the colon working well. Dr. Kellogg, I mentioned him earlier, he said 3 intakes of food a day should equal 3 evacuations a day. And the colon has a mind of its own. If you tell it to go more, it won't. But once you start implementing the lifestyle changes, as I've described, the colon usually starts to work a little bit better. And you can probably tell that a train is passing by us at this moment with its horn.
That's all right. That's all right. We can go on to our next question. Hello, Sister Barbara. I need help with severe constipation. Well, we're on the topic. Severe constipation. Large volume of stool in the proximal colon, suggestive of superimposed constipation. How do you help out Pauline here?
Okay, so with that, I would do the added treatment of applying castor oil compresses to the colon. When you apply castor oil compresses to the colon, it has the ability to penetrate and help to break up such things. I would also get the colon tea. Now, it may take 2 cups a day, it may take 3 cups. I believe that God designed for every person to be their own doctor, and part of being your own doctor is listening. Now, it was probably about 3 years ago, because I was at home, I decided to go through the treatment program at Misty Mountain Health Retreat, the detox. And I found that I only needed 1/3 of a cup of tea a day to get my colon working. But we've had people that have needed a full cup, some people need 2 cups, some people need 3 cups. So the beauty of this tea, it gently stimulates peristalsis, so it helps that colon to start going from the inside. And it can train the body back into going regularly. How long will that take? We've got a saying in Australia, how long's a piece of string? It can be 1 inch long, or it can be 10 yards long. So I don't know how long it'll take. That's why you listen. You listen. And then eventually the body usually starts going by itself. And
it's beautiful. God's remedies are so simple and beautiful.
And the lady
Continue.
did say, what can I do right now? She could find a colonic irrigation therapist, and that warm water going in and out can clean the colon quite quickly. If she can't find one, and if it's just not an option, there's the simple enema kit. You can buy an enema kit from a pharmacist, and you just insert the little tip with about 1.5 cups of water, massage your tummy, and sit on the toilet and let it come away. So that's a lot quicker one too.
Great, thank you. Rose asks, my teenager suffers from UTIs, nausea, and vomiting during her periods. What could help?
Well, those symptoms indicate quite a strong hormonal imbalance. So the yam cream needs to be taken, and what the lady might find is that every week it'll get every month I should say, when she gets her periods, it might be a little bit easier every time. But please don't take antibiotics for a UTI, because antibiotics, when taken for a UTI, might bring relief, but they will contribute to the next UTI. But D-Amos is a product you can buy that is concentrated cranberry. And one lady told me that when she gets the stinging with the urinary tract infection, she'll take a teaspoon every half hour until the stinging goes. That will ease it, and it will also help to heal it.
Wonderful, wonderful. Thank you, Rose, for your question. Danette asks, I've used Golden Seal for root extensively for years. This is a reference to a question earlier that came in, and Barbara shared that Golden Seal was good if the problem was dental. The person didn't ask that particular question. They didn't say where their issue was, but that Golden Seal is good for root, right, Barbara? Just to reiterate that.
The Golden Seal is a root. It's a very fine root. It's a very expensive herb, but you do not need to use much. And you can buy the Golden Seal root as lumps of dried root. You can buy the Golden Seal as powder, as tablets, as capsule, but it is all the root.
Wonderful, wonderful. Sanette asks, is sauerkraut good to eat every day?
Sauerkraut is fantastic to eat every day, because sauerkraut is high in lactobacillus, and that is a wonderful bacteria that is present in our gastrointestinal tract. My sons, they make the sauerkraut, and my daughter-in-law, she uses it. Her little children, they eat it nearly every meal. So it's a great product.
Thank you for the question, Sanette. And Vita says, is nutritional yeast bad? Those are those little yellow flakes that people eat for seasoning and vitamin B12, right? What is that good or bad?
I
What do you
never
say,
use
Barbara?
it. I never use it because you can't kill yeast. And I have found that a lot of people's health problems have a yeast factor there. I also know that my PA, if she eats anything with that nutritional yeast, her lips swell up immediately. We don't use it at all in our health retreat. What I do to flavour food is I use what God gave us in the herbs, in the good quality salts, the good quality oils, and you get beautiful flavourings with those. So I never use it.
I remember hearing years ago on that nutritional yeast that it was identified also as an excitotoxin. Is that
Yes.
that was a long time ago? Is that still something that's discussed?
It
Is that true?
That's true.
Yeah. All right. Senjuta first asks, is it okay to apply castor oil directly to the skin rather than a poultice
Well,
pack?
what happens, and you'll discover this, as you apply it to the skin, it takes a long time to soak through. It's very sticky, so everything sticks to it. Your clothes stick to it. It's actually a fairly uncomfortable situation. But if you use a castor oil pack, that pack should be several layers thick, which means it can hold a lot of castor oil, which means a lot of castor oil can go into you. So when you use the pack, it just means that more castor oil will penetrate into you, and it also is a wonderful way of protecting your clothing.
Very good. Very good. Thank you. Crystal asked, what kind of juices do you do at your retreats?
The main juice that we use is 80% carrot, 10% apple, 10% celery. It's called the vegetarian's milk. All our other juices are variations on that theme. Sometimes we'll do a little less carrot and do beet. Sometimes we'll do a little less carrot and do cucumber. Sometimes we'll do a little more apple and more cucumber. So they're all variations on the theme of the carrot, celery, and apple.
Yum. Oh, that sounds so good. What is the best way to cleanse and strengthen the kidneys?
There's a chapter in my book on kidneys. The whole chapter's on kidneys because we have seen people about to go on dialysis not need to go on dialysis. And remember Psalm 104 verse 14 that God gave herbs for the service of man. You might be surprised that some of the most powerful kidney herbs are celery and parsley. And there are a variety other of herbs, but the beautiful thing about celery and parsley, you can just about implement that into your food every day. Make sure they're organic because organic foods give a far higher nutrient content and have a higher concentration of the actives that God put in there for the kidneys. But kidneys suffer when people don't drink enough water. Kidneys suffer when people are having teas and coffees. Kidneys suffer when someone's on a high stimulating diet, which meat is a big stimulant, and the coffees, the wines, that's what really hurts the kidneys. So to revive the kidneys, drink more water, ease off the stimulants until they're out of the diet, implement those foods every day. And I'm sure places like Trader Joe's, Whole Foods, they will have tablets that have herbs in them for the kidneys, and there's a variety of herbs that are great for the kidneys, so you can use those.
Great, great. Thank you. Jacqueline asks, I wonder what is your advice if you suffer of GERD and the ingest of ACV to lower glucose spikes?
ACV, apple cider vinegar, I don't use. Apple cider vinegar is one stage before alcohol. Apple cider vinegar can interfere with digestion. So where most people use apple cider vinegar, I use lemon. So we use lemon internally. In my book, Sustain Me, I have got a chapter on diabetes, and in that chapter I show how you can get blood sugar levels stabilized just by really eating low glycemic sugar, glucose foods. So that's the best way to do. If there's a blood sugar spike, you have to look back and look at what did you just eat, because something you've just eaten has caused this spike. making sure you're well hydrated. We talked in a previous section, GERD basically is much the same thing as reflux or heartburn, and I gave the basic principles there already. In my book, Sustain Me, I have got a chapter on the stomach, so I've got a whole section on how you can conquer GERDs or reflux, or also called heartburn, which basically is eating most of your food, breakfast and lunch, eating light at night if you eat at all, taking magnesium to close that muscle.
So not Tums. You know, those little things that you get at the drugstore in America, they're called Tums that people take for heartburn.
Oh, I don't know, Toms.
Yeah. Well, you're blessed to not have been cursed with the Walgreens products there then in Australia. But yeah, when you talk about heartburn, I used to have that problem. And the principles you teach, I know from experience on this and many things that have come up actually, that they work. And when you eat that light supper or no supper at all, and you go to bed not still with the food in your stomach, there's so many benefits from that. In addition to having better, resolving your acid reflux, but you just sleep better. So you get better quality sleep, right? We got a hello from Botswana, by the way. Hello to Vipeti.
Okay.
And another yeah, go ahead.
That's true. The other thing I would suspect at Tom's is antacids. And to take antacids is like shooting the cows because they keep getting into the vegetable garden. Just shut the gate. Then you don't have to shoot your cows. When you take antacids, you're shooting the cows. Just shut the gate. Shut this little gate.
Right on. Yeah, Tums is an antacid. That is what there was another brand too. But how can you help active overweight children? So they're active. So I guess exercise isn't the answer. They're already active. So how can you help active overweight children lose weight? This child eats pretty healthy, loves vegetables, fruits, and protein. Could it be they need a metal detox? If so, how? Thank you.
Well, I'd like to also ask the question, are they eating any wheat? There's a book called Wheat Belly by Dr. William Davis, and it's a very appropriate title. And he shows how the wheat was hybridized back in the 1950s. And in the hybridization of the wheat, it created a very complex protein structure, but also a starch structure that gets the blood sugar level up very high, very fast. And the body's reaction is to quickly store it as fat. So a lot of children are carrying excess weight because one of the main reasons they're eating too much sugar, but it sounds like this child eats well. Maybe it's the wheat. And in the US, there's an excellent bread called Simple Needs, and you can Google Simple Needs, you can order it, they'll ship to your door, and it's a gluten-free sourdough bread. In fact, the guy that makes it is a friend of mine, and he uses our original sourdough starter, and it's an excellent bread. So I'd like to suggest changing over to that form of bread and also getting the pastas, the cereals, all the carbohydrates right down, and eating most of the food at breakfast and lunch. And if there is a meal taken at night, try and make it totally grain-free. You know, maybe a smoothie, maybe soup, maybe gluten-free crackers with avocado, just very light at night.
Great, thank you. Hope that's helpful to that child. B.A. Best says, Barbara, what are your thoughts regarding Arnica montana sublingual and topical gel? God bless you.
Well, the arnica is an interesting herb because it is a very powerful blood thinner, but it is very difficult to take it by mouth. Apparently, the only way it can be taken by mouth is in a homeopathic way, which I don't use. I think the best blood thinner internally is cayenne pepper, but externally the arnica is excellent. Arnica can be applied in the form of a tincture or a cream externally, and if there's been a bruise, it helps to thin that blood that congeals with the bruise. So we do use arnica, but we use it externally.
Wonderful, wonderful. Von Hales says, I have just been diagnosed with too much calcium in the blood any natural way of clearing this, as I don't want to take prescription drugs? This is Yvonne.
That's a very good choice not to take prescription drugs. And if you hadn't had a blood test, you wouldn't know there was too much calcium. And it's quite possible if there's too much calcium today, there won't be the next week. That's why I never have blood tests. Did you hear that? Never. I never have a blood test. And I find that people have blood tests and there'll be, it'll pick up something and they'll get stressed about it and think that they have to take something. But the fact is, blood tests can change from week to week. They're not a totally accurate guide. I do acknowledge that in some cases the blood test can be indicative if there is a problem, but it's quite possible that this high calcium in the blood isn't really a concern. There's definitely no need to take any medication for it. But calcium can be high in the blood when someone's on a high acid diet. So the most acid-forming foods are meat, sugar, wheat, caffeine, alcohol, and the most alkaline foods are all your vegetables. So lots of vegetables, fruits. If you go over to a more alkaline diet, you might just find that that'll settle down that acidity. The acidity, because when the acidity settles down, then the calcium isn't pulled into the blood. You see, calcium is the most alkaline mineral in the body. So if there's calcium in the blood, one would look at why, and often it's because of a high acid diet. Forgive me in my long explanations, but I don't believe there are any wonder cures. And I also want to know why, and I also like to explain why something would work.
Is it also true that some people take too much calcium as a supplement and they're eating those acidifying foods like you mentioned, meat and sugar, and then you end up with kidney stones? And actually, if you hadn't been taking so much calcium, do you ever encounter people who take too much calcium, take it as a supplement?
I don't advise anyone take calcium. You see, the bones aren't made of calcium. They're made of 12 minerals and 64 trace minerals. So the best thing you can do for your bones, which is, I guess, why most people that take calcium, the best thing for your bones is eat more dark green leafy vegetables, have more Celtic salt, and there's your minerals in their proper balance. And what you say, Scott, is true. If there's an excess, it can build up on your bones as bone spurs. It can be settled in your kidneys as kidney stones.
Very good, very good. I love God's packages. You never need to worry. Am I getting too much such and such when you're eating food God made for you to eat? Sweet Life says, I heard L-cysteine, zinc, selenium are good multivitamins. There are those ones that you do take. I sometimes take a little extra zinc, eat a little extra pumpkin seeds if I'm coming down with something. Are these some good supplements to consider? Maybe give a broad perspective on supplements, and then also answer Sweet Life's particular question there, if you wouldn't mind.
Yes, I don't take any supplements, and I guess that gives the message, but I do go to great lengths to make sure that I eat very well. And if at all possible, I eat as much organic as possible. I believe what Hippocrates said, let food be your medicine and medicine be your food. And then some people would say, but Barbara, aren't the soils deficient, so the food's deficient today? That is true. And that is why I like organic, because an organic farmer feeds his soil, which means those organic foods have a far higher nutrient content. I also acknowledge in certain cases supplements may be necessary, but you mentioned zinc, get your pumpkin seeds. Pumpkin seeds are very high in zinc. Yes, I would rather take a quarter of a cup of pumpkin seeds with my breakfast and my lunch than take the zinc supplements. So your food contains all that we need, but yes, make sure as much as possible that it's organic. A lot of people don't realise is when people are taking stimulants like the caffeine, the refined sugar, that's leaching minerals out of the body. So far better to stop the mineral leaches, have as much organic as possible, and you can get all your nutrients there.
Excellent, excellent. And the previous question had selenium. It's that's heavy in the Brazil nuts, right? I mean, just one Brazil nut is all you need, right?
You are right. Only 5 Brazil nuts a day will give us all the selenium we need. And I did
Okay.
have Brazil nuts this morning.
Awesome. Awesome. Eva asks, castor oil should be bought in glass bottles. The oil can draw toxins from the plastic bottle. Okay. So thank you for Eva's comment contribution there. More questions. Wendy Lee asks, hello, are there foods that will heal peripheral sensory neuropathy?
Okay, there are, but I'd like to comment on what you just said about the castor oil.
Yeah, please.
Castor oil doesn't absorb, so it can be bought in plastic bottles.
Castor oil, there we go.
That's why you can use the same castor oil compress every day for a couple of weeks, because it's not absorbing, it's penetrating. Now, if you had a choice of glass or plastic, obviously glass is always superior, but I know at Misty Mountain we get castor oil bulk and it all comes in plastic bottles. I don't think that's a big point.
Good.
So the next question was?
Peripheral sensory neuropathy. What foods for that?
Now, the doctor says there is no cure, but you know, in God's book, there is always a cure. And in my book, Sustain Me, I have a chapter on poultices, and I show how to make cayenne pepper compresses. Cayenne pepper compresses can be applied to the soles of the feet and worn overnight. We've had people that have had no feeling in their feet, and after one night, they wake up and they can feel pins and needles. Now, what does that tell you? That's the first sign that life is coming back. You see, cayenne pepper moves blood, and blood feeds nerves. So you can awaken the nerves in the feet if they're dead, if they've gone to sleep. Please don't put people's feet that have got peripheral neuropathy in a bucket of hot water. You will damage the tissues. No, no, no. But you can apply cayenne pepper compresses to the soles of the feet. When someone has peripheral neuropathy, I would advise applying it to the soles of the feet about 3 nights a week. How often would you apply it for? Well, that's when you listen. When the feelings come back into the feet, obviously you don't have to apply it anymore. If you apply it every single night, the person's feet can get too hot and they're going to want to put their feet in a bucket of ice all day. So you do it carefully and, you know, maybe every second or third night, and you just observe the body's response.
Very good. Jessica, I need shots in my eyes every 6 weeks for bleeding wet macular. What can I do? A bleeding wet macular. What can I do?
I would not allow anyone to put a needle in my eye. Every time the needle goes into the eye, it damages the tissues and then you get scar buildup. But there is a herb that will seal any bleeding in the body. It's called cayenne pepper. And in my book, Sustain Me, I have a chapter on the eyes, and I show how castor oil, either put in the eye or just one drop, you know, wiped over the eyelid, it'll still penetrate through. That can be very helpful. And I do put a herb mix into my book in the eye chapter. It's Eye Bright Golden Seal, and for macular degeneration, a little bit of cayenne pepper. You let it cool and then you strain it and you wash your eye with it. Won't it sting? Briefly, but then that settles down. And if it stings too much, just put a little bit of water in your eye. But cayenne pepper, it'll seal bleeding anywhere in the body. But if I were this person, I would not allow any more needles to go in my eye.
I like that. Danette is addressing Jolie and saying silent reflex is when the acids are coming up into the esophagus while you sleep, but you don't feel it. So just clarifying the term if people didn't know the term. I think we've discussed that one pretty well about eating light at night or none at night in the evening. Demonine George says, does the sugar in fruits fuel cancer cells? I guess that's asking, should we not eat fruit? Or maybe answer 2 questions here, if you would, Barbara. Somebody's been diagnosed with cancer versus just the rest of us. Are we, fueling cancer cells by eating fruit?
We are not fueling cancer cells by eating fruit unless we have cancer. Cancer cells consume 15 times the glucose of any other cell. Dr. Otto Warburg, he discovered that and got a Nobel Prize in 1946. And I quote that in my book, Self-Heal by Design, He also discovered that cancer cells live in an anaerobic environment. In other words, they hate oxygen. So what we advise, if someone comes for us wanting help with cancer, to have no fruit for 6 weeks. And what that does is that's designed to give a sledgehammer effect to cancer cells. In the book, The Germ That Causes Cancer by Doug Kaufman, Dr. Holland writes that when you deprive cancer cells of glucose, they self-destruct. Now, it is true that every cell in the body runs according to glucose. But the cancer cell, because it consumes such high amounts of glucose, it hungrily grabs that glucose that is coming from a high sugar, high fruit diet. But the healthy cell, it can wait for the glucose to come from the carrot and the celery and the lentil. So it is true that every cell in the body runs according to glucose, or runs with glucose as their fuel. So if for 6 weeks there's no fruit at all, a lot of those cancer cells, as Dr. Holland stated, they basically self-destruct because they're not getting that glucose boost. So what we suggest is 6 weeks on no fruit. And in my book, Self-Heal by Design, I outline that. And then after 6 weeks, they go onto a very low sugar diet. So they can now have maybe Granny Smith apples, grapefruit, which are very low on the glycemic index. And then after a couple of and of course eating lots of vegetables, legumes, nuts and seeds. And then after 2 months on that, they go to the antifungal diet, stage 2. And that's what we call the maintenance dose. And on that diet, they have very low sugar fruits like all your berries. And what do I mean by maintenance dose? They stay on that diet until they're healed. And we've seen many people, again, heal from cancer. We can't heal cancer, no one can. Only the body can. And when it's given the right conditions, we've seen it do that.
Oh, that's beautiful. And when you mentioned the sugar, the guy who was on the screen a second ago, he said he's 9 months in. I know you're not reading while you're thinking about what you're sharing. I was reading and trying to listen at the same time. He's 9 months in, having given up soda. And I think that is just a wonderful choice that you made. I did it. I used to be a Mountain Dew addict. So praise God. Now we've got a question from Diane. She says, could you recommend something for pain from sciatic? I had a fusion 14 years ago, but still in pain. Physical therapy, 3X's, chiro, acupuncture, injections, relying on pain meds now. Please help. Diane, we're here to help. Barbara, what do you say?
It's also an illustration of, as much as possible, you avoid surgery. I've seen people get relief with surgery, but I've also seen people get worse with surgery. So it's almost like playing Russian roulette. I'm very sorry to hear that, because the sciatica is a pinched nerve, and I usually advise people go to the chiropractor and just assess that. But if it's been fused, I wonder if they somehow fused the sciatic nerve in there if she's getting so much pain. So I'm very sorry to hear that. I have known many people to conquer back injuries by strengthening the core muscles. You see, the core muscles in our abdominal area, they're all linked to our lower back. So, but this lady apparently is seeing a physiotherapist. So the other thing that I would do, and I don't advise pain-killing medication because of the way it damages the liver, the kidneys, and also kills off our good flora in our gut, that most people don't realise that high doses of cayenne pepper has a pain-killing effect, because cayenne pepper is a natural analgesic. And here in the US, you can buy tablets called Cool Cayenne. And the cayenne, I think it's with aloe, I'm not sure, but it means that as it's coming out the other end, it doesn't burn too much. So that's what I would advise, going for the cayenne. I know that when I broke my arm, I was lecturing the following week, and often by the end of the day, my arm was aching. I would mix a half a teaspoon of cayenne pepper with a teaspoon of aloe vera, and I took that high dose cayenne pepper, and that would ease the pain.
Jolie asks, what is the yam cream and where can you get it? This is, Barbara's been sharing with us about resolving hormonal imbalances and the importance of yam cream in that. So I'll just ask Jeremy if you wouldn't mind putting that QR code up for the Anna's Wild Yam Cream, and that previous questioner and anybody else can scan that QR code, get yourself some of that. Go ahead, Barbara.
Another point is, we are finding that the Anna's Wild Yam Cream is not very easy to get, and it's an Australian cream, but there are some excellent American yam creams. And one is Comfort Yam Cream. I know my daughter at barbaro'neil.com sells it. I think Living Springs sell it as well, but also they have another couple of yam creams. And why I encourage Americans to buy American creams is I like supporting local industry, but also I think they'll find it a little easier to get.
Wonderful. Yeah, the Anna's is Living Springs has got themselves stocked up on it, and I remember the supply chain issues with that, and so it's still available at the moment. And could you share your URL one more time, Barbara? I always like to do that with my guests. What is your website?
My daughter, who lives in Wisconsin, her website is barbaro'neil.com, so that's pretty easy to remember.
Great. Thank you. Elsie says, can any oil help me with my dizziness with eyes or neck for it?
Okay, so if there's dizziness from neck, then I would question, has there been an injury there? A lot of people are giving themselves neck injuries with their phone neck. You know, this position like this. You know, a lot of chiropractors and osteos saying they're finding neck problems. We really should look at our phone like that. And if people are at computers all day, you know, neck injuries can come up from that. So be very mindful of your neck, how you treat it. Osteo chiropractors, there are some excellent ones around that you can check that out. And also just check for full hydration. If there has been a neck injury, comfrey cream applied to that can boost healing in that area.
Wonderful. And then you brought up yeast earlier, excess yeast, and not want to eat the nutritional yeast, but for just general questions about yeast here, how do we get rid of excess yeast in the body? Asks this person.
Okay, so my book, Self-Heal by Design, has programs in there to help rid the body of yeast, and I've had many reports how successful it was. So the antifungal diet, stage 1, for a couple of months, and then the antifungal stage diet 2 until the symptoms are gone. At the same time, taking herbs that will kill yeast. I suggest alternating your herbs, maybe a week on olive leaf extract, a week on grapefruit seed extract, a week on portiaco. So in my book, it lists all of those herbs.
Excellent. And by the way, the number of times that both Sustain Me and Self-Heal by Design have come up really have vindicated the opening question when we started with, you got the 2 books. They're really of unique value and high value as individual resources that folks should take advantage of. Natalie asks, any ideas to relieve or heal a Pseudomonas bacterial infection on the leg that has been resistant to every antibiotic? It burns so bad. I cry daily. Oh, Natalie, we're sorry to hear this. As she changes the bandages, there's a lot of pain. This has been going for 6 months. What does she do with that? By the way, I had a bacterial infection on the leg. I want to hear what Barbara says. I just had that this year, the worst thing I've ever had on my leg. But let me hear Barbara's official answer.
I'd like to begin by saying the body is designed to heal itself, and we have this most incredible immune system that is able to deal with all bacteria. But sometimes it can get a little out of control. And do you know the word pseudo? Do you know what that means? Pseudo is implementing that maybe part of this is in the mind. And I'm not saying that it is, but it's always interesting when they put that word pseudo there. So so remember that the definition of insanity is to keep doing what you've always done and expect different results. If I was this lady, I would have no more antibiotics. They haven't done it so far. And antibiotics have a devastating effect on our gastrointestinal tract, so please, no more of those. I'd be interested to know how big the wound is and exactly where it is, but one of the best ways to clean it out, and does kill bacteria, is pouring in hydrogen peroxide. Hydrogen peroxide, a lot of times in surgery that they use it. I know a friend of mine's a doctor, and she said they'd had a guy who'd had a motorbike accident and scraped his whole leg, and it was full of gravel. They put him under general anaesthetic, poured hydrogen peroxide all over it, and got the scrubbing brush. Ooh, aren't we glad he was under general anaesthetic when they did that? It's such a good wound healer, is hydrogen peroxide. The other thing is seawater, and the blood is the healer. See, Leviticus 17:11 says the life of the flesh is in the blood. The blood is carrying the oxygen, the nutrients, it's carrying the water, it's carrying away waste, and it's also bringing the white blood cells. And so whenever there's a wound that's not healing, I always question, is the blood getting to that area? And the person might be surprised at what I'm suggesting, is you can make a powdered mix of half golden seal powder and half cayenne pepper and sprinkle that into the wound after you've cleaned it with hydrogen peroxide, maybe seawater. But before you put anything on it, I'd put it in the sun. The sun is a wonderful healer, and the sun is antibacterial. You might have to have a fly swat there and keep the flies away while it's in the sun, and not the sun through glass. You want it in total sun. If the area hasn't had sun for a while, you might just do it for 10, 15 minutes twice a day. And then you sprinkle in a mix of equal sodium, cayenne pepper powder and golden seal powder. You could make it up in a little jar. Now, you might think, it's hurting me. Won't that hurt me anymore? Remember, cayenne pepper has an analgesic effect. So it'll be an initial tingling, but then there'll be an easing. There'll be an easing and a dulling of it. And then make sure that the dressing you put over it is a non-stick, because you don't want anything to stick as those edges are healing. And it just came to my mind another one, which is aloe vera. Aloe vera contains a growth stimulant, and you might even, and you see, much depends on how wet the wound is, how dry the wound is. Aloe vera is very soothing, and some people have found that they'll mix those powders with aloe vera and then put that in the wound. So there'll be a little bit of trying different things and just observing how it's responding. And I'd also like to suggest that this lady could send a photo to barbara@barbarao'neill.com, and my PA will get that and we can have a look at the picture.
Wonderful. And I can vouch for the hydrogen peroxide. That was the trick for me this summer when I got the poison ivy in the middle of the night. My toenails are scraping it in the middle of my sleep without me thinking about it. I didn't even realize I had the poison ivy yet. And then all of a sudden that gets infected from that ordeal. And just the bubbling, sizzling of that infection with the hydrogen peroxide, once I figured out the remedy on that, and it started to recede. And it took some time. Like you say, things take time. But Verona asks, are chili, jalapeno, habanero, and your cayenne peppers, are these all the same thing? Chili, jalapeno, habanero, are those equivalent to your cayenne pepper recommendations?
Well, in the book Jethro Kloss, Back to Eden, called The Bible on Herbs, he devotes half a page to every herb, but he devotes 10 pages to cayenne pepper. And if I had his book here right now, I could have a look at basically how he defines the cayenne pepper. But my understanding is that chili is from the chili family and can be irritating, whereas cayenne pepper is from the paprika family. So it doesn't quite have as many irritating things in. So I'm sorry that I can't quite define that, but I think the jalapeno are more from the paprika cayenne family.
Well, thank you for the question, and we'll go to Elsie. Just a quick question. What oil or anything for a dizziness?
I think we just had that question, and I talked about
Yeah.
checking spine and applying comfrey cream to the area.
Yeah. Our next question is from Jabi. Hi, Sister Barbara O'Neill. I greet you from Jamaica. God bless you abundantly. I have learned so much from you. And there are, I'm sure, many comments like that we're putting a lot of the questions up. We love each one of you guys. And I know that Barbara really appreciates that you have ears to hear these things and that you're using them for your health and that you may be a servant of God there in Jamaica and everywhere. I missed Karen there. She just flew in and out. Hi, Karen. Beverly says, I've been using the salts Barbara recommends due to high minerals. However, recently found out they are saying the salt has high levels of toxic metals. Please reply to this. I'm very concerned.
Well, I'd like to assure this lady that the Celtic salt is a hand-harvested sea salt on the coast of Brittany, and the French government have declared 4 million acres heritage zone. So it's a very pristine part of France. The Baja salt is another hand-harvested sea salt, and it's hand-harvested from a fairly pristine area on the coast of Mexico. Also understand that heavy metals are heavy. They're not in the seawater. They sink to the bottom of the sea. So the seaweeds, the crustaceans like prawns and crabs and lobsters, they're the ones that are more likely to have it. And the bigger fish are the highest concentration of mercury. The little fish eat the seaweed, the big fish eat the little fish, and so you're starting to get an accumulation. So there's a lot of claims about this with the salts, but I can assure that person they could even contact Baja salt or Celtic salt. They're constantly testing their salts and they can give current testing results. There's another claim that they're high in microplastics. This microplastic claim has come about, but they show that there's more microplastics in the air we're breathing than in the salt.
Well, I think that settles that. By the way, your mention of the crustaceans, I don't imagine you're going to be going to Red Lobster at one of our American chain restaurants after this interview.
No.
Not a chance. Not a chance. John O'Lifty says, what is good for tinnitus?
Okay, tinnitus, or we say in Australia, tinnitus. That's a very Aussie accent there.
You know what? I thought it was tinnitus for years, and some doctor corrected me and said, Scott, it's actually tinnitus. But yeah, whatever we call it. What is it? I think most listeners probably aren't aware what it is. And how do you help this person with it?
It's actually ringing and noises in the ears. And I'd like to say to you too that every rock singer has it because it's a result of damage to the fine mechanisms in the ear from very loud noises. See, whenever we hear a loud noise, we shrink away. It's the body saying, don't go there. But you know what happens? We don't listen and we keep listening. And, you know, the rock stars and the people in the front rows of the rock concerts, they really should have earmuffs like you've got on, Scott, because what's happening is it's damaging the fine mechanisms in the ear. So often when I investigate with people, they nod, yes, I used to use a jackhammer. I've had guys who've used jackhammers when they were younger. Also a lady, she said she used to have a gym and they had very loud music in there. People that have been in the war, bombs going off, it's damaged the fine mechanisms in the ear and unfortunately is now damaged. But we have found that it can be managed. The ears are part of the eustachian tubes, and the eustachian tubes are tubes that link the eyes and the nose and the mouth and the ears. And if they're kept free, no build-up of mucus there, that can greatly reduce tinnitus. So what you would look at there is what's causing any excess mucus in that area. It's usually allergens. It might be allergy to chemicals, allergy to breathing in molds, or foods. So the main food allergens are wheat, dairy, oats, peanuts, and refined sugar. Now my sons, they're built like bodybuilders. They're construction workers, meaning that they're landscapers, they're builders, tilers, carpenters, and they love oats. They eat them for breakfast every day, and they can because they have no health issues. But I have found that if there's any irritation or inflammation in the body, these foods can increase that inflammation. So my suggestion is to stop those foods, get those eustachian tubes nice and clear. Often when people have sinus problems, they'll also have tinnitus because, again, it's built up in the eustachian tubes. And those sinus problems are usually a result of the allergen foods. So stopping the allergen foods, but then you've often still got that bit of a build-up there from when the allergen foods were eaten. So what can be done then is sniffing a little bit of fine golden seal powder. So sniffing that little bit of powder can help to clear out this area. I also have found, and I've spoken to people who've done this, and an illustration is when someone lives near a train line, after a while they don't even hear the trains. But if I stay at their house the night, I wake up with every train. So you can train yourself out of actually hearing the buzz. And so that's another probably more mental point of just training yourself out of that.
Yes, excellent. By the way, that's helpful to me, all of that, because I played in a rock band and I've walked this journey that you're describing that the questioner asked about. Sirios asks, bone spurs are broken up with castor oil compress. Would this cause any imbalance or pain on bone knees?
Not necessarily. In fact, I find that of bone on bone knees, and by the way, it may not be. I'd reject that bone on bone because if the brain pitches bone on bone, it often will contribute to bone on bone. I would take the castor oil poultice and apply it to the knee every single night. It'll help to lubricate the area. It'll help to break up any bone spurs. That's what I would do.
Excellent. Well, we are heading. I can't believe it's been almost an hour and a half. We're going to be cruising to the end here. Jeremy, can we take another question? We got 3 minutes left. By the way, that's the book. Get the book. Sustain Me. Really get both of them, but that's going to be a really good Christmas present right there with the holiday shopping season. And same thing with the sprays. Those are nice little stocking stuffers as well. This one's tasty. The Revitagard. It's got the iodine in there and lots of good stuff. But let's see if we can sneak in a couple more questions. Marjorie asks, how do you cure or reverse cirrhosis caused by autoimmune hepatitis?
Now, I'd just like to state right now that I don't believe in autoimmune diseases. We've seen people totally heal from so-called autoimmune diseases, and I know that God didn't make the body to attack itself. I acknowledge that the people are suffering from the symptoms of this, but remember, the body wasn't designed to heal itself. I mean, it was designed to heal itself. It wasn't designed to attack itself. Let's get those words right. So with psoriasis, that's indicating the liver. In both my books, I have a chapter on the liver, and I show herbs that can revive and restore the liver, because the liver is a unique organ in that it can regrow. And so if someone has this, the first thing I do is reject the diagnosis, because sometimes people are given diagnoses and then the brain accepts it and they begin to live the diagnosis. So please reject that diagnosis and do acknowledge that our body was designed to heal itself, and our liver is unique in that it can regrow. And it can regrow under the right conditions. Castor oil compresses to the area, plus taking herbs, St. Mary's thistle, or often called milk thistle, dandelion, they're two excellent liver herbs. And I think shops like Sprouts, Trader Joe's, those type of shops that have supplements, you can probably buy a liver supplement that has the herbs in it. Take that 3 times a day.
Great. Well, we're out of time, folks. Barbara, we'll have to do this again. I mean, there are so many people with so many needs. And thank you, everybody, for being here and bringing your questions and your comments and just being a part of this community, this Living Springs community. And what a delight. I have to say that felt like about 45 minutes. How was that an hour and a half? Did I have a time change that happened in the middle of this or something? But God is so good. Barbara, give us some closing thoughts as we cruise to the end.
Time goes quick when you're having fun.
Yeah. What closing thoughts, comments?
I know last week we had a lot of book sales and people were buying the Sustain Me for Christmas presents. And I wish I'd had that book in my home when I had children. So yes, it's a wonderful Christmas present to give to people. What I'd like to encourage people with is that have faith. Have faith in this incredible body that God gave us with an inbuilt ability to heal itself, no matter what diagnosis you've been given, because sometimes they get it wrong. Sometimes it's not totally accurate, and no one knows you. It might be so for this person or that person, but there's no body like yours. So I'd like to encourage people to have faith in their body, have faith in the wonderful God of heaven that gave them this body and also gave us these simple natural remedies, these simple guidelines that when you give them to the body begins to respond and heal. That's the good news.
Beautiful. It's such hope, having this conversation and people in the darkness and despair of where they're at this moment, they hear that hope and it lifts the burden and you know that there's a path forward and that there are people that care and that there's a God that cares. So I see you guys next episode on LSR Live. We're going to go back to our normal Wednesday, 7 p.m. Eastern, 6 p.m. Central. We're actually going to be transitioning that also. So stay tuned for further announcements on time. But next Wednesday will be 7 p.m. Eastern, 6 p.m. Central. And it's going to be a fun one. We're going to meet with the LSR team and talk about healthy holiday cooking. This is not a season of the year when you need to balloon your waistline and end up toxic on the other end and then needing to detox and be miserable on January 1. We can thrive and enjoy healthy food through these holidays, celebrate with family fellowship and the gifts of God that he's given to us. So we'll see you all there. And thanks, of course, to our producer. I keep mentioning Jeremy back there. Excellent job, team. Christian Digital Network, from likes to lives changed. Scan that QR code, subscribe to their channel over on YouTube, and we'll see you guys next time. I'm Scott Ritsema with Living Springs Retreat.